Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us. But before we begin, I'd like to thank our sponsor, Altman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Jillian Berkshire, APRN-CNP. You got to tell me what that is later. Okay, with Altman Oroville Carrollton Health Center. Good morning and welcome to the show, Jillian.
Good morning. Thanks for having me back, Brad and Paul. Excited to talk about school health matters.
Are you directing from Carrollton?
No, I'm not.
Okay. Okay.
All right. Well, we'd like to remind our listeners today that our program will also be available on our podcast. You can download that from your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and please subscribe to our program.
Well, today we are discussing childhood health and wellness. What is a child wellness exam?
A child wellness exam is a comprehensive exam with your doctor, nurse practitioner, or physician assistant. It's typically done yearly. It includes the physical exam. It provides an opportunity to review vaccines. We get height and weight, discuss physical activity and good nutrition.
And what else? Anything else?
Pretty much the whole gamut of discussing the whole child and anything that may affect their health and well-being and any concerns a parent may have.
I see. Okay.
All right. So let's talk about setting our kids up for success. Why is it important to get a child wellness exam when kids are going back to school?
So the back to school time is a little bit chaotic, but it's also a big marker for the year where parents are remembering like, oh, we need to do physicals. We got to get school supplies. So it's just a big marker as a reminder to get those wellness exams. And it gives us that yearly definitive mark for talking about wellness and nutrition and vaccines. And then we'll talk a little bit later about the vaccines, but those are really important for the schools. They like to have those lined up. So if we get those done before we're going back to school, it just makes it a little bit easier on the school staff.
Is there a
I'm sorry.
is there a particular age that children should start to get an annual child wellness exam?
These actually start at newborn. So within the first week of life, we have normal wellness exams established. And then in that first 2 years of life, they're pretty structured and routine. So newborn, 2 month, 4 months, 6 month, and then throughout the child's life, usually after 2 years old, they start to become yearly.
I missed a question in the beginning. Tell us about yourself and your career with Altman and your current position with primary care department. I'm assuming you have had other positions with Altman in the past.
Yeah, so I've been with Altman Orville Carrollton Health Center as a nurse practitioner for the past 6 years. Prior to that, I worked in the emergency department at Altman for approximately 3 years. I'm the school-based telehealth nurse practitioner, and I care for 12 districts, and we're going into our fourth school year.
Not recently, but I was down to Carrollton, a few months ago. I could not believe the growth of Carrollton compared to many years ago. Where is your facility located down in Carrollton?
So we have two Altman facilities in Carrollton. We have the Altman Orville Carrollton Health Center primary care office on Trump Road, right by the Huebner Chevrolet. And then further down at the high school, we have our first school-based health clinic, and that is open year-round. It's to the students and staff, and it also can take the public for primary care.
I believe they have a brand new high school down there, don't they?
Yes, they have a brand new high school and elementary, and then that clinic just sits beside the schools.
I see. Okay, very interesting. Are we drilling oil for oil down there yet?
We hope so.
Yet again? Okay. I know that was a hot spot a long time ago, so for fracking. Okay. You're up, Brad.
So tell me about how we set our kids up for success. You mentioned that getting an annual wellness child exam is the way to go. You know, is it a problem for is it a problem for kids that you're seeing getting access to healthcare and having a regular physician? I kind of ask because I feel like we have a lot of patients that come in the pharmacy and they don't have a regular doctor. So I'm wondering how many kids don't have a regular doctor. Do
A
you see
lot of
that?
kids do not have, yes, we see a ton of that. And that's really why the school-based programs were developed, is because of lack of access to primary care. Most of our schools are in rural settings. So there's just not the volume. There's also not the volume of physicians going into primary care. So we really have a shortage. But yeah, so that's why we make access in the schools, and then on our Altman sites too, it says has a long list of providers that are accepting new patients.
Excellent. So why don't we talk about vaccines? What vaccines are important for children to get, and at what age should they get these vaccines?
So like we talked earlier, they start at infancy, big hepatitis B, rotavirus, the tetanus shots, Hib, a lot of the respiratory stuff. So Hib and pneumonia, and then you got polio, MMR, and varicella for chickenpox. And then as we get older, seventh grade is a big marker. They get their first meningitis vaccine, and then HPV, which helps prevent some reproductive cancers. And then 12th grade, we're talking about the second dose of the meningitis vaccine. And then there's two meningitis vaccines. So the meningitis and meningococcal B vaccine is usually talked about around junior, senior year, for dosing for kids that may be going away to college because there's increased risk on those big campuses. But the school, if you're doing those yearly wellnesses, you're not behind on these vaccines, or you're having those discussions with your providers about which vaccines are appropriate for your child. So, and then don't get missed. Some people are skipping some of those in between ones, and then that's where things might get missed. And the school nurses, one of their primary jobs when they go back to school is checking all those records. And so and to make sure that everybody's up to date and compliant. So that's a big job for them. So if we can keep them those in order for them, it makes their job a little easier.
Back in the last century when I was in grade school, we had all kinds of shots and tests and all that kind of stuff in the school position. What do we do in the schools now? I mean, we had smallpox and we had polio and all kinds of stuff, injections and the sugar, which I understand is not considered to be very effective nowadays, the sugar cube or whatever we did oral.
Yeah, we don't do those anymore. But luckily, since then, we've gotten the polio vaccine, so we help prevent some of those illnesses that people in my generation may have not even seen or be aware of, and that's why these kids are getting the vaccines to avoid some of those complications. The school nurse, it does a lot more than they get recognized for. One, keeping up with these vaccines, but they also do vision and hearing screens. They contribute a lot of that, and even some of the schools have like dental programs. And then they help with our telehealth services for the schools we're affiliated with.
Why is it important for your child's hearing and vision to be checked?
So hearing and vision are basic senses that we need for learning. Now, obviously, if you have one of these impairments, you're still capable of learning. But if we can pick up on one of those impairments early, like the need for glasses or even like a hearing aid, it really helps the child to absorb what's being taught much easier. And so the hearing and vision exams should be done at those comprehensive wellness exams, but they're also done at the beginning of the school year by the school nurses. So hopefully, we're not missing any of those things. But if at any time a parent thinks that their child is having problems with their vision or hearing, they should definitely reach out to their primary care provider or the school nurse. The school nurse has access to doing testing at any time.
So you mentioned dentistry. It is important to have your child see a dentist regularly. How do you manage that?
Well, ideally, we aim for every 6 to 12 months for dental visits. Um, most providers see children all the way through adults. There are some specially pediatric providers I know in Stark County. We also, many of the schools are contracted with almost all of them have a sealant thing to help prevent cavities, especially in those molars that come around to each district that can be, the parents just have to sign a paper if they would like that. And then some of the districts are now even upgraded to having a mobile dentist unit that comes by the school multiple times throughout the year, that the dentist is there and doing a full exam, because they know that access to care is lower in these areas.
Jillian, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for a vaccine season? Stop in or schedule your pneumonia, Tdap, or shingles vaccine online at Medicine Center Pharmacy.
Alrighty then. Let's talk about acclimating our kids to going back to school. So I had a friend of mine tell me this week that she lives in another state, but she said, "Oh, it was the first day of school and everybody's excited to go." She said, "Wait till Friday. They won't be excited to go." What do we do to help kids when they might be nervous about going to school?
So I think it's like as adults, most of us work all throughout the year, and so that doesn't change. But the kids on and off, now that they've been off a routine, so we want to get them back to a regular routine, a good night's sleep, good nutrition, setting up bedtimes, waking up times, so that that transitions a little bit smoother when that week approaches, and even like a week or two out, starting those things, so that when the first day of school comes, that at least that part has been reestablished. And then one, talking about what's making them feel nervous. Sometimes as adults we take for granted that we know what's going on for the child or what they're nervous about, and what they may be nervous about may not even be in our realm of thought. We may be thinking like it's a teacher or it's a certain kid that they don't get along with, and it may be something as simple as like they wanted a blue pack instead of a black one. I mean, like, for kids, it's really little details that can kind of get them off tilter. So just asking them, what is bothering you? What's making you feel nervous? And then each school, or the majority of the schools, that at least the ones we're affiliated with, are having back to school events or back to school bashes. And this allows an opportunity. It's like the extreme open house. So it allows them the opportunity to walk around the school, meet their teachers, see where the cafeteria is. This is super important when they're first off to school, so your preschool, kindergarten kids, but also if they're in where they're going to change a building or in a new school, because those big transitions obviously add some anxiety to the situation, and we can really put them at ease by just walking around with them and encouraging them and letting them know that what they're feeling is really normal anytime you make a big change, and that the teachers are there to help. The school staff is amazing. They all know it's going to be kind of busy and hectic those first 2 weeks, and they're there to help them.
Wow.
All right, you touched on something. It is like a change in routine, isn't it? Because some are doing whatever you want, and now there's new habits to be formed or reformed. So how about, you mentioned sleep. Can you talk about healthy sleep routines for kids? Because it's even hard for adults at times, let alone.
Yeah, so healthy sleep is pretty much the same for everyone, except the children need a few more hours of sleep than we do as adults. They really need a solid 8 to 10 hours of sleep each night. So determining what time you think your child needs to get up for the school day, and then going back 8 to 10 hours and making that their bedtime. And then just setting a routine. So, we're gonna have dinner, then you're gonna get a shower. We're not going to have any screen time within an hour before bedtime. Those screens put off a lot of light, and most of the time, if they're on a screen, they're either doing some kind of work or like fun stuff like video games or watching videos, and that just kind of ramps up the brain. So we're trying to get the brain to calm down and unwind so that they can transition into sleep very calmly. So 30 minutes, allow 30 minutes to unwind. You can read during this time. It's a great opportunity as part of the bedtime routine to add a little bit of reading, even if it's 5 to 10 minutes. And then that really helps the educational part of school too. 10 minutes of reading each day builds those reading abilities. And then just have a really quiet, clean, comfortable, dark area for your child to sleep in, making sure their bedrooms has less distractions for them.
All right. How do we plan for safe travel to and from school?
So identifying first, how does your child going to get to school? Are they going to ride with a parent? Are they going to ride the school bus? Are they a walker? Are they a young driver that's driving themselves? So for the young drivers, we really got to keep harping on them about wearing their seatbelt, um, driving at the speed limits, trying to avoid distractions, leave early so they don't feel that rush, because that rush and causes some distracted driving. For your younger students that are going to get on the bus, take them to the bus stop, go with them to the bus stop, look around, identify things like road traffic, how fast is it, staying off the road, staying back from, the curb. And then how, the bus driver's going to, pull up, stop, they're usually going to signal for the kid to get on safely. And then when on the bus, their behavior is so important on the bus. I think kids get a little wild on the bus because especially after school, they feel like they're free, but they're not really free yet until we get home. Like the behavior can be so distracting to the bus driver, and we want to get the kids safely from point A to point B. So just be polite on the bus, don't throw stuff, try not to be yelling and screaming, and just keep reminding them of those things because they're young and they're forgetful. So just keep encouraging good behaviors.
You can stop that stuff, huh?
No, you can just encourage it to slow down, I think.
Okay. I can remember the school buses driving by my house. There were 30, 40 kids screaming and yelling at each other. And I think, my God, how's the driver handle it the whole
Yeah.
time? So anyway, okay,
You
on
don't
enough.
have to go to the zoo, you just watch it drive by, right?
Gosh. Okay, another subject. How can people who need a primary care doctor find one who is accepting new patients?
So we have an Altman Anywhere app. You can go to your smartphone app store and you can download it. It's super easy. And then it has a tab on the main screen of that app that says find a doctor. And you just scroll multiple filters, location, specialties, and it'll show you who's available. If you don't have a smartphone, you can also go to altman.org and there's a section right on the main screen that says find a doctor and they can help you out.
And what about backpack safety for children? I noticed they were carrying all kinds of stuff, little school books, lunch, and computers, and all kinds of stuff. So what do we do with this?
So one, the weight is a big concern. So really just transporting the stuff that's needed. It gets a little lighter now that a lot of stuff is on tablets and computers. They don't have those 4-inch thick textbooks that we used to have to carry. But just making sure they're not overloaded with unnecessary stuff. And then make sure that they're wearing them on both shoulders because the backpacks are designed to be carried on both shoulders, not just one. And then we can help prevent some of those back pain and shoulder injuries.
Most of the students now have a computer or something like that they're issued, as opposed to a pile of textbooks. Is that not true?
That's pretty accurate. Yep. It's mostly all done on the computer.
Gosh, it's amazing. Um, okay. How can parents establish good homework and study habits?
Well, first, setting the expectation that homework is a priority for our schoolwork. Not unfortunately, not all the work can be done at the school while they're there, and homework gives us and good study habits gives us an extra opportunity to review and absorb that information because not everything can be absorbed quickly. So taking that extra time to do that stuff, and then again, routines are super helpful. So some children respond well to completing their homework as soon as they get home. Others need a little bit of downtime from the school day, a small break, small snack, and then they can get started. And then other families have very busy after school schedules. And so this requires a little more creativity. You might have to be doing some of that work or some of the reading in your car ride, or at a sibling's practice. You may get the other child's homework done, or once returning to the house. So it requires a little more creativity if you have a lot of extracurriculars involved.
Okay, so you got these, every one of these students has a computer. How do you check their homework?
It's all on there, and then actually parents have access to a lot of their information, so they can see how the grades are going. Every grade, if you really want to, you can log in and see how it's working.
I experienced homework here lately, okay? I have to renew, and Brad does too, our pharmacy licenses in September. So all the learning and all the testing and all that was on a computer. And I'm thinking, oh my gosh, I'm doing homework again at home. So
It never stops, does it?
it
Once you
does
keep
not.
learning.
It does not, for sure. Okay, it is the bottom of the hour and time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I am your host and pharmacist, Paul White. This morning, we are talking to Jillian Berkshire.
All right, well, let's talk about breakfast. Is breakfast still the most important meal of the day?
Absolutely. These young kids are waking up, it's been 12 hours since they've had dinner. They have a long school day ahead of them, and they need a good nutritional base, a good blend of proteins, carbs, and fats. For the families that may be wondering what that looks like, there's the myfoodplate.gov. It's a good resource for balanced nutrition. It's designed in a plate instead of a pyramid like we may have grown up with, but it helps families know what a proper meal should look like. And then they have the energy, if basic needs are met, good nutrition, good sleep, good, shelter, then they're ready to learn and have a good environment for doing so. Also, many of our districts for offer free breakfast, free lunch, and food assistance programs. So those families that are in need, where food, may be a scarcity or a concern, the school system is very prepared to help provide those meals. So if you're in that situation, please reach out, because they do a great job helping our families.
I think it's interesting too that many schools have adapted to providing breakfast for students that want to partake. We never had that when I was going to school, so it was just one of those things. But I think it's interesting how they've made use of that as a service at the school systems too.
What is this? What is a breakfast like in a school for the students?
Most of them are offering like a nutritional bar or cereal, and then some form of fresh fruit, and then they always provide like a white or chocolate milk to go along with it. So it's a okay breakfast. You especially for the kids that are either rushing out the door or need that food, and it provides some extra assistance. It's a great opportunity.
Interesting.
We talked a little bit about kind of getting ready to set them up for success, about nighttime habits. Do you have anything else you want to add about helping your child develop a consistent bedtime routine for maybe listeners just joining us?
Yeah, so as the parent, we set the consistency for our family. So we just want to really be consistent and try to develop those routines for the children that are, elementary, a little bit older elementary. We can start talking about like why is it important? The body needs the rest. It needs time to regroup and reset. And then setting expectations from the very beginning, like we really need a good night's sleep. It's so important. The proper amount that's needed, avoiding caffeine, good nutritional habits. So that, it's hard to go to sleep if you're feeling hungry, daily exercise, and then avoiding those screens at bedtime.
I want to mention something about caffeine, if you don't mind.
Yeah.
Caffeine's an interesting thing, and it seems to turn up in places more and more than you don't realize, whether it's Coke or Pepsi or a Red Bull or some crazy energy drink or even just coffee or tea. But, lately I've been reading that if you consume caffeine after 2 o'clock, you run the risk of it delaying your quality sleep patterns. So, I'm guessing if a kid comes home from school and has a Coke at 5 or 6 o'clock, that's going to really screw up nighttime habits. So, just something to think about, mom and dad out there. Um,
Yeah,
water isn't a bad thing.
right. Water is great for the body. It's really, a lot of people just underuse it or underestimate it. But and a lot of kids they're drinking pop, which yeah, it has the caffeine, and that late caffeine definitely affects the sleep habits. But also it's a lot of unnecessary calories. As our kids are, as our society is facing the diabetes endemic, it's also filtering into our kids, and those are really calories that they don't need with the sugary drinks. So if we can get them on
Mhm.
water and like water, and water is what they do, it's really better for them throughout the lifetime.
All right, I have to tell a small story because you mentioned calories and pop, and then I promise we'll go back to kids. But we do a lot of weight loss consultations at the pharmacy, and I have a patient who just simply stopped drinking the volume of Mountain Dew he would drink every day, and he lost
Mm,
14 pounds in the first 2 months.
Sheesh.
Yeah, I had somebody that was similar that had for diabetes. Definitely it came back with a high A1C and then was saying, "Oh, I consume all this pop." And I was like, "Well, just try cutting that out. Don't make any other diet changes." And just the amount of pop that they were drinking brought their
Mhm.
A1C back to a normal level. And it was like I was like dumbfounded because I was like, "Can't
It is
believe that
staggering.
just stopping pop." But he was like, he started exercising and stopped the pop, and he really made a big change. But I don't think that that's the normal patient, but it
Mhm.
definitely shows like how much sugar is in each can.
Mm. Jeez.
It's crazy. Okay, how about healthy hygiene habits?
So brushing teeth and flossing twice a day. I find this in the wellness exam because I always talk about this in every wellness exam. I'll ask kids if they're brushing, and you get these looks, but it's all ages from elementary through high school, and just reminding twice a day, twice a day, twice a day. As they're older, you can kind of encourage like, hey, the people that you're looking to date don't like smelly breath. So they get that kind of encourages them a lot of time to brush a little more. And then showering, bathing daily, that 8 to 10 hours of sleep. And then we really want 60 minutes of physical activity. These kids need to get outside and play, and just get off the screens for a little bit and just enjoy the outdoors because it's so good for physical health, but also for mental health.
Mm.
Well, let's talk about screen time because it is staggering. I mean, I have personally set the little reminders or alerts on my phone to, like, shut off some social medias after 30 minutes a day. But it's still staggering how much time we spend I don't know, as adults on our phones. And I don't play games and do things like that, but the kids, I had a parent the other day said, "Well, we limit our kids' screen time to 4 hours a day." And I'm thinking, it's kind of a lot.
It
So
is a lot. They like for less than 2 hours a day, which that's really hard. I mean, I guess that's like 2 hours of your free time in screen time because a lot of their day is spent on screens at school. So they're already
Mm.
probably getting that 2 hours at school, but really at home, really limiting it to 2 hours or less per day. Um, and if you're really finding like homework's a challenge or getting outside is a challenge, if you look at that screen time and it's greater than 2 hours, it's really taking those opportunities away from your child and your family to get some of those other things in, like a good night's sleep, the exercise, and then that extra homework time. And if you keep it lower, then a lot of times those other things can work for you.
Mm. Jeez. Okay. What can children do to increase physical activity, or can the parents get the kids to do
Well,
increase physical activity?
I have a question for you, Paul. How hard was it? Did you guys go outside and play? And how many hours were you outside as a kid playing?
Hey, we disappeared out of the house in the summer months in the morning, came back for lunch, okay, and then went after lunch, went back out to play in the woods and all other, play baseball, all that stuff.
Yeah, so it's like really been a societal shift, and like we really need to get the kids outside, getting
Yeah.
outside. And sometimes it's hard, like they will put up a fight, but once you get them out there, they have a blast.
Yeah.
You get to, fresh air, find some bugs, hit some baseballs, like it's great. And family involvement, like if you will go out with them, they're so much better about going out and starting the process. And if you don't have a place outside for physical activity, then do things inside. The old calisthenics, some push-ups, some sit-ups, some squats, that it'll help the kids stay in physical shape and be active.
I gotta wonder if bicycle sales have gone down to the dumper, because I used to see kids riding a bike down the street, and because we got real wide streets in my allotment. And I'm thinking, what the heck? These kids don't even have bicycles anymore. And maybe they got a basketball hoop in the driveway or something, but there's just it is nothing like what it was when I was a child, when I was a kid, you
Yeah.
know?
And they really need it. They really need to be outside, and running around, and even just the free play of just, without any rules or, not many restrictions, obviously some safety stuff, but just getting out and as they say, being a kid and running around and playing is so beneficial.
Okay, if your child is feeling sick, what should you do?
Okay, start with identifying symptoms. Are we dealing with a fever, a cough, headache, runny nose, sore throat? If your child has minimal or mild symptoms, then there are many over-the-counter options to help relieve these symptoms. You want to make sure the medication's right for their age and the proper dosing. And I'm sure your pharmacists at the medicine center pharmacies are willing to help, and provide some assistance when they come in. Also, if the symptoms are not improving in a couple days, or something seems worse, I always want the parents to trust their instincts. They know their kids better than anybody else, and if something doesn't seem right, then get a hold of your family doctor, or if you're affiliated with one of our schools, call the school nurse, and we could try to help you with a visit too.
Okay, Jillian, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy. I love your smile, by the way.
Thanks.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show. So, what options are available for healthcare for your sick child?
So we want to talk about appropriateness of care. So we have your primary care office, you have stat cares, you have the ER. We don't want to be going to the ER unless it's really emergent, really severe belly pain, some broken limbs, major stuff, seizures, stuff like that. Most of the other stuff can be cared for at your primary care office or at the stat cares. And then, so if you're looking for those primary cares, we talked about, the Altman app that you can look at and find a primary care. And then we also have school-based clinics and telehealth services. So we have telehealth services at Carrollton, Malvern, Minerva, Tusky Valley, Sandy Valley, Claymont, Canton City, Rittman, Wayndale, and Wayne County Career Centers. So all of those schools, if your kid's sick, you can just reach out to your school nurse and she'll give you options that are available to you. And then we've also have school-based clinics that are providing primary care services for the student staff, but also for the community. We have the one we talked about at Carrollton, but Claymont also has one, and we have two new locations opening at Malvern and Tusky Valley that we're really excited about. So in the next few weeks, we should see those opening, and they will all be accepting new patients. So if your kid's sick, go ahead and reach out in any of those areas, and we'll get them taken care of.
So in Carrollton, how many
Mhm.
actual facilities are there? And
So
is it close to the school?
So there's two facilities. We have our Altman Orville Carrollton Health Center, which has been the primary care location that's been there for years. And then we have the newer school clinic, which is right on the school campus to the right of the high school. It's its own
Hmm.
little building, and there's different entrances for the public and for the students and staff. They keep them separated. But it's a clinic that can provide primary care services and then acute sick visits for students and staff, but primary care services for the whole community.
Okay. I know that Altman's facilities uh, away from the hospital are really excellent, and they really do a good job. My daughter experienced a situation that was really quite difficult, and they took care of her very well. So, way to
Yeah,
go. Way
we're
to go,
fortunate
Altman.
to have great facilities and great providers working for
Yeah.
us.
So let's talk a little bit about how students can use your services. So you said if a child has an issue at school, the school nurse can kind of interface. Is that like, so would you do a telehealth visit for the child possibly at the school? Is that how your role works?
Yeah, so my role works at these facilities that we talked about. It kind of ear pain's the easiest one for me to kind of describe. So your child has ear pain, they wake up in the morning, you send them to school, and then either you reach out to the nurse or the nurse reaches out to the parent and says, "Hey, the kid's not feeling well. We have this telehealth service we can offer you." Then we interface like really like a FaceTime visit. But at the schools, we have these upgrade, we call it the gold standard. They have these really fancy carts that allows us to listen to their heart and lungs. We can look in their ears, the back of their throat.
Oh,
All of
wow.
our schools have point of care services, so strep, COVID, flu, urine dips. So we can get results pretty within a few minutes on, does your child have strep throat? Do they need an antibiotic?
Mm.
The families are included in all sorts of ways. They can be on site, they can be virtual. We can give them a call after. It's really designed to work in whatever works for the family. The parent is always contacted before the visit to make sure that they want it. So even when they sign the consents, the nurse is always going to reach them out to them the day of and be like, is this what you want? And then we send prescriptions, labs, x-rays right from our visits. And we've had more complicated stuff, but most of it's cough and cold. But we don't. If it's anything that we can possibly help, we take care of it. And there's some things like I can't do stitches from virtual health. We don't want to
Come
deal with
on.
chest pain and massive shortness of breath. Those are things to go to the ER for. But we've had all kinds of sorts of things and ordered probably more tests than you would normally get if it's appropriate, right from the telehealth. So it's been a great program for us.
Tell us about Kelly Health.
So that is the telehealth. It's like the virtual platform, and then we can also listen to their heart and lungs, yeah, and look in
Yeah.
their ears. The ears is probably the most exciting part because the parent can see it right with you if they're on in person or virtually. They can see the picture of the ear too, and we can really talk about like what constitutes as an ear infection and needs antibiotics, and then what might just be like a little bit of fluid and need an allergy or like a Flonase type medication.
Interesting. Wow.
Yeah, that is. That's pretty cool. I think it's neat to know that there's actually, so much that you hear about telehealth. You taught me something today. I didn't know you guys had that because you figure you talk to somebody and you give them your symptoms, and it's kind of hard. You're missing that other piece where you need to hear a heartbeat or see in the ears or, whatever. So it's nice you've got that feedback. That's cool.
Yeah, our exams are pretty comprehensive. There's, a few little details that you might not be able to do what you could do in person, but because of the telehealth, but 90% of the exam can be completed with the tools that are provided at the schools.
Are a lot of people using telehealth?
Yeah, I mean, I think we were over 2,000 visits last year for a program that just started a couple years ago. And
Mhm.
there was some hesitancy, with the COVID pandemic that caused some hesitancy, and then just telehealth in general, like it pretty much ramped up during COVID. So people were still uncertain. But in the school districts that we see a lot of kids in, they use it. And once they start talking about it and get comfortable with it, it's really a time saver for the families and a convenience for the families.
So I have to ask this question. I think that's fantastic that you can save, half an hour trips to and from and people leaving work and all those frustrations. How many kids do you frustrate because you say, "Yeah, you're not sick, go back to class"?
A lot, a lot of them, because it is one of our goals.
Hmm.
A lot of kids though want to be in school, I think, but you do have your handful that really like to go home. But we try to stick to the Ohio Department of Health guidelines with, 24 hours out for strep, 24 hours
Mhm.
out for pink eye, which, sometimes that can be frustrating on my side too. Like you want to get them
Mm.
back sooner, but you're held to these standards. So not everybody's sharing all the germs. But we do, if it's allergies or, ear infections, like most ear infections, if most of the kids can tolerate the day of school until they get their antibiotics at home or the ibuprofen at home, because the state is really watching those seat times and not even so much days anymore. They want the kids in because we know that they're missing a lot if they're out of school more than a day. They're missing a lot.
Mm.
Well, do you have anything that you would like to leave our listeners with today? And please make sure that you share any contact information that you feel is relevant for parents and caregivers.
Okay, so yeah, I think we're gonna have a great 2025-26 school year. Just work on getting back into those routines, get those wellness exams if you haven't yet. Here at Ullman, we're here for you in your communities and in your schools. If you're looking for those primary care providers, please go to that Altman Anywhere app and look up a provider that's close to you to get those visits established. And then all of our school-based clinics, even the new ones, we have Carrollton and Claymont, and then Malvern and Tusky Valley will be opening soon. They're going to all be accepting new patients. And if your child attends one of our affiliated schools and not feeling well, just reach out to your school nurse and we'll try to help you. But we hope everybody has a great year, and make sure that you're using your local medicine center pharmacies for your prescriptions.
Okay.
Thank you.
Super. Thanks very much. Okay, I think we're out of time, aren't we, Brad?
Yep.
So, thanks to our guest, Jillian Berkshire, school-based telehealth nurse practitioner, Altman Orville Carrollton Health Center. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again right here on next Friday at News Talk 1480 WHBC. And thank you very much, Jillian.
Thanks for having me. Have a great day.
Yes,
Thank
ma'am.
you.
Take care. Stay warm.